Money FM 89.3, the best of the afternoon update.
Money FM 89.3. Now, as our understanding of the human body advances, the pursuit of longer, healthier lives is no longer a distant dream, but an achievable reality. Today on Industry Insight, we're diving deep into the fascinating field of longevity. As scientific advances continue to evolve, we're learning more about how to not just live longer, but to truly live better, with a focus on extending our health span, which is the number of years we live in good health. Indeed, how we live our lives has increased the incidence of chronic conditions and age-related diseases. So to find out the ways we can slow down biological aging and improve the quality of life, we're joined by Lindsay Cooper, co-founder of Chi Longevity, a pioneering clinic at the forefront of this field. In fact, Chi Longevity is a global, expert-led center of excellence and the first private healthy longevity clinic in Singapore to pioneer slowing down biological aging.
Oh, thank you very much, Lindsay. Thank you for having me.
Now, first off, let's talk a little bit about Chi Longevity. What was the genesis of this business?
Yes, well, it was the coming together, really. 3 co-founders. We all came at it from slightly different perspectives or directions. First and foremost, of course, there's Professor Meyer, who spent the best part of 25, 30 years in geroscience, working at major research labs and universities and hospitals around the world. My fellow co-founder, Craig McGee, he came at it from a very personal experience. Family member who had a full health crash and had to be rebuilt medically and had gone on a journey of discovery as to how to do that. Thankfully, that was a very positive end outcome, but he had very intimate experience as a result of that. I was coming at it from a business perspective. I had a fledgling hospitality business, and as a result of that, I could see the trends in medical tourism. I could see that, discerning clientele was increasingly aware of the importance of preventative health. We're hearing of medical breakthroughs, we're wearing devices and wearables, and perhaps accelerated by the whole COVID experience, we're wanting to engage in more health optimization, diagnostics and treatments and so forth. So the 3 of us knew of each other here in Singapore. Over many walks in the park, came up with a business plan to really bring breakthroughs, preventative health and longevity medicine out of the lab and into clinical practice.
So let's get down to the specifics. You talked about more people being interested in preventative health and longevity. So what gap does Chi Longevity aim to fill?
Yes, well, I think we're all familiar with the levels of chronic disease that we face in the developed world. Even in a very well-managed society like Singapore. Singapore, as you may know, has been termed a blue zone, one of the longest-living societies in the world. Average Singaporean will live to 85. But health span-wise, that time of living in good health, 75. So 10 years on average of ill health, in many cases multiple chronic diseases. That's not a good situation for any individual. It's not a good situation really for any society, particularly with other pressures, low fertility rates and so forth. This is an expensive business looking after an elder generation in ill health. So at a societal level, there's a very real need. As I described, increasingly individuals themselves were aware that they could actually do something about their health, that they didn't just have to hope for the best, wait for symptoms and then get hopefully some degree of treatment when they're sick, that actually they could try and prevent themselves becoming sick in the first place, and that there were all sorts of new things happening, new ways of tracking and engaging with that space. People didn't really know how to engage with it, how to do so safely and effectively, and that's where we feel that Chi Longevity, because of its, obviously co-founded by Professor Meyer, one of the top 10 scientists in this field really globally, if we could bring a very high-quality product to the marketplace, there would be demand for that for a host of reasons.
Indeed, the how-to is very important, and you have just the tools for this. And your state-of-the-art diagnostic tools like the VO2 Max test and is it the H reader or the HEE reader? I'm not sure. Very innovative tools. So could you walk us through how these tools work and their impact on early disease detection?
Yeah, but they're just tools of many, many tools in actual fact. So VO2 max is well regarded as an effective signpost to longevity. It measures the amount of oxygen you require at peak physical activity. The better that you can process that oxygen, the better you're likely to perform. The age reader, it actually stands for Advanced Glycogen Products.
I see.
And that's really a measure of sugar-type crystals in your bloodstream that bind to proteins and fats and so forth, and it's a measure of cardiovascular risk and so forth. But those are just two of many. We have literally tens of thousands of data points on each individual. We're looking at it. Biological markers of aging. We use specialist labs overseas who are focused purely wearing that lens, really looking into strength of ability to repair cells and limit damage on cells and immune systems. We've got mental health and brain health testing. We've got psychological testing. We've got full battery of tests with regards to glucose metabolism, cardiovascular, and so forth. So you highlighted two, but really there's thousands of data points that we're trying to take a 360-degree view of you as an individual, because no one thing can stand in isolation. It's not just about the biological testing. We need to know how you operate as an individual. That's including your social networks, including your environmental system, the stresses that you're experiencing, the sleep patterns you may be having, the exercise you may or may not be doing, over and above the biological testing, which, as I say, is also very extensive.
Okay, so you're talking mostly about diagnostic tools, but what about regenerative medicine and emerging technologies like AI? What kind of trends are we seeing, perhaps beyond our shores?
Well, it's early days in truth. Billions of dollars are going into research just now. But whether it's Jeff Bezos or it's the Evolution Fund in Saudi Arabia, whoever. But it takes time for that research to come through from being tested in animals and then translating successfully, as it often doesn't, into human trials. And of course, not just the efficacy of that, but the safety of that. But because of Professor Meyer's experience in that whole field, she knows what's happening around the world. Mm-hmm. We can see a very big, thick pipe. It could be regenerative medicine, it could be stem cells, of course, related. It could be senescence, could be nootropics, could be any number of things. But they're walking their way down the path of the testing regimes and the approval regimes just now. So I think over the next 5 to 10 years, you're going to see that the menu of interventions that are possible, which are a mixture today of lifestyle-type related things, eating and sleeping and exercising and so forth. Increasingly, we're starting to see therapeutics and repurposed drugs and so forth also on the menu. I think that medical side of things is going to be where the big expansion is going to be of the intervention menu going forward. It's a very exciting time, but they do have to come through the pipe. Now, somewhat unfortunately, many parties are around the world kind of jumping the gun. They're making a lot of noise that you can go and do many of these techniques in other parts of the world, not properly regulated, and as I say, not proven to be safe or effective. So we've got to be mindful of that and not get too carried away and keep everything within strong guardrails of what is safe and what is effective.
Okay, let's come back to the VO2 max test and the age reader. Could you tell us more details about those tools? I mean, what can they do for your clients?
Well, in the case of the VO2 max, we will have, prior to doing the VO2 max test, for example, we will establish your base metabolism levels, and so that we've got that base. And then we're putting you under some degree of stress to see how you respond to that. Now, this has been done many, many, many times across the world, and accordingly you can see where people sit within a distribution curve and see whether they can actually be better than that. And we're always trying to optimize people. I think this is an important distinction. When you go for regular health screening, your physician is looking to see whether you're inside what is deemed to be, in quotes, a healthy range. Often these ranges are very wide. Because of our access to the research and so on, we know what optimal should be. So you could well be within the healthy range, but you could still be a distance away from optimal. And we're constantly trying to optimize you in every aspect that we look at. And if we're able to do that, that will have knock-on effects in terms of how you can function, knock-on effects into health span, knock-on effects into lifespan as well. So we do the tests, we want to see where you stand, we know ourselves what optimal is, and then we have interventions to try and help get you there. It's the same with the age reader. Again, it's been done so many times. There's a distribution curve of where people sit on that, and we can identify where you are on that and then see whether you have a higher likelihood of cardiovascular risk and consequently curate a program of personalized interventions to help improve upon that so that the next time you do the test, and we're constantly testing, we can see if we're moving the needle in the right direction.
I see. So basically, there are tools to help us improve our health through us changing our lifestyles, right? Some lifestyle factors, which includes, I would imagine, diet, exercise, and stress management?
Yeah, all of that, as well as therapeutics, as well as supplementation. It could even involve, some psychological approaches and so forth. Everybody is uniquely different, but we're all integrated from our own health perspective. So it's not just one marker that we're looking to do. We're trying to, A, optimize that marker, but B, in the context of every other aspect of your life. How are we able to optimize that as well as many others? And that takes a 360-degree view. It requires your lifestyle assessments, but also biological assessments, genetic assessments, microbiome assessments, a whole range of things to see how we can improve the important biomarkers that we've identified.
So, Lindsay, how do you see the field of longevity evolving over the next few decades? Do you think there's a possibility even that we could see significant life extension or even the reversal of aging itself?
Well, there's a $6 million question, Lindsay. Of course, anything is possible. Breakthroughs are happening, as I say, every day. I think everybody gets a little bit obsessed with the longevity or lifespan focus, and I think it'd be far, far better, actually, to be thinking of health span. Mm-hmm. As I mentioned at the outset here, there are significant gains to be made for society and individuals by compressing that gap between health span and lifespan. And if you do so, because you've been optimized today, next month, next year, next decade, that's going to lead into those health span gains and almost certainly translate into some gains on lifespan as well. And who knows what the scientists will come up with in terms of some of the techniques that you touched on earlier with regenerative medicine and so forth that might, who knows, be able to push lifespan barriers even further out. But there are significant gains, I think, to be won in health span firstly, and everything else is a knock-on benefit. Where does this go? I think that we're at the early stage now of medicine 3.0, as it were, where there's much more focus, I think, in the next decades on prevention. The sick care side of things is fabulous in many markets, particularly good here in Singapore, and there'll be, I'm sure, fabulous continued breakthroughs and improvements there, absolutely essential. What has been somewhat lacking to date has been preventative health care, and I think that's going to significantly grow over the coming years and decades. And for all the reasons we touched on earlier, it is very important, and increasingly people are aware. And as I say, all of this research that's going into the space is likely to bring dividends too, and businesses like ours and other partners that we work with and others could be working with, I think will take this to satisfy a much larger mass market. And maybe AI will help, compute power will help. Certainly, I think we have now broken through a barrier in terms of consumer awareness. You can hardly turn on a Netflix or open a magazine these days without an article or a series devoted to prevention and optimized health and longevity and so forth. So I think we're at the start of really quite a change.
Exciting stuff. Lindsay, I know most of this stuff still in the research phase, and you mentioned earlier that Chi Longevity emphasizes evidence-based approaches to aging. So could you let us in on what Chi Longevity might be working on that we can look forward to?
We are agnostic of what comes next. What we want to come next is something that's been proven to be effective and proven to be safe. And Professor Meyer has eyes and ears on that world. And so the scientists are doing that. We're at the clinical end of applying that and bringing the expertise of longevity-trained specialists who are able to review all of the results from these diagnostics, for example, and are able then to translate that into an action plan for the interventions and, as I say, moving the needle. So we're agnostic as to what comes next. Obviously, everybody is extremely excited about the potential for stem cells. I think people are very excited about the potential for senolytics, which strip out dead and dying cells, which have a negative impact. There's a lot of work going into inflammation, and there's a lot of work going into the microbiome. There's a lot of work going into cognition testing and MCI and so forth. So, there's no end of things to be very excited about, but it does need to walk its way down the approvals and testing process, and we'll see what comes out. And when it does come out, and Professor Meyer is absolutely happy with the efficacy and the safety, then it comes into our clinic first and is offered to our clients where they have the confidence and the trust to be able to engage with this.
Okay, just a quick question. Can you tell us more about your clientele? What kind of clients are we talking about? People in the 50s and above, and what sort of demographics?
Yeah, well, we range from our youngest so far has been 19, our eldest has been in the late 80s. But of course, that is not representative. There's a massive bulge in the middle age bracket from sort of 35 to 60 in truth. And I think there's a number of reasons for that. And I think, actually, at the lower end of that range, they're starting to feel the first twinges that they're not bulletproof, they're not immortal. They're starting to feel it themselves or see it in their friends. And they realize that, well, maybe I should get on top of my health and understand my health and work proactively on my health. But also that age bracket are looking at their parents. And they're seeing their parents at age, say, 70 or whatever, and they're saying, well, that will be me unless, I can take today's knowledge and apply it in ways that their parents couldn't. So I think that kind of explains that big bulge that we have, which is, 70% of our clients are in that age bracket, sort of 35 to 60. But you can make significant improvements in your functionality, in your health span, right out there into, the 7th and 8th decades of life. So, this is something that can be applied to everybody. We're all aging, in truth, of course, from day one, but it starts to kick in really from sort of 30 on. Our interventions can help people at almost any age in life. We don't do children, because there's other growth aspects to that, but from 20 onwards, we're very happy to serve. Demographics in terms of spending capability at the moment, the specialist labs, it's low volumes that they work with. It's an expensive or relatively expensive journey. If you do the full 360-degree view, we try and make it as easy as possible with on-ramps and off-ramps to match all budgets. So we try and produce a service that is compelling and relevant at a price point that most can afford. But there's no doubt that the larger part of our clientele so far has been, fairly affluent people who are aware of these trends and want to engage with them. We've recently announced a strategic collaboration with the Four Seasons Group, who are seeing the same trends as ourselves. We just opened our second clinic, our first one in the Four Seasons in Singapore, and we'll be doing that elsewhere within the Four Seasons empire. So there's clearly a demographic there of high net worth type people who are wanting to engage with this, are aware of it, don't want to do so in a doctor's surgery or a hospital, want to do it at their own convenience in a high quality location. I think, though, of course, this has to democratize, and that's why we're speaking to other B2B to C type partners who are interested in what we're doing, want to bring this to their clientele and spread the net wider and democratize this in every way.
All right. When it comes to aging well, there's so much to talk about, but I'm afraid we've run out of time, Lindsay. All right. Thank you very much for sharing your insights into aging well, preventative medicine, and the future of longevity medicine. Lindsay Cooper, a co-founder of Chi Longevity, which is a global expert-led center of excellence and the first private healthy longevity clinic in Singapore. Thank you, Lindsay.
Thank you, Lindsay.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.